A county in Texas is becoming a hotspot for coronavirus infections among babies. More than 85 children under the age of 1 have tested positive for the virus since March. Doctors are warning newborns may be more vulnerable to COVID-19 than older children who usually show milder symptoms.
We have to keep in mind that newborns and infants have underdeveloped immune systems. So that may be one of the reasons why COVID can hit particularly hard in this group.
A recent study of Chinese children showed 90% of them who tested positive had mild to moderate symptoms or none at all. But that study also showed that 10% of infants who tested positive did become very ill. Health officials say what you flush down the toilet could serve as an early warning sign for coronavirus. News 5's TANEISHA CORDELL explains how your waste could help us learn more about the spread of COVID-19 in Ohio.
If you have coronavirus, even if you're asymptomatic, the Ohio Department of Health says traces of the virus will show up in your feces 3 to 7 days before you actually get sick and potentially have to go see your doctor.
They plan to process about 70 samples of wastewater each week, searching for RNA fractions or strands of coronavirus, using your waste each time you flush.
We're starting with the largest cities because that represents the largest population for the state and reflects where we're seeing most of the cases.
The Ohio Department of Health will take raw samples from 17 wastewater treatment plants across the state, including those in Cleveland. The samples will be taken from all 3 of Northeast Ohio regional sewer district plants, then shipped to Columbus to be tested at OSU.
Out of the 120 million gallons that may flow through on a normal day, about a liter of that may go into the actual testing, but it's representative of that 24-hour period.
The goal is to help give health and state leaders a heads up of possible spikes in cases and to help spot trends to slow the spread of COVID-19.
With one test, we can test essentially everyone in the service area. So it's a very fast and efficient way to get a really quick snapshot of the prevalence of the virus in the community as a whole.
And while the study won't determine if wastewater with traces of coronavirus can make someone sick, officials assure the virus will be thoroughly treated and removed from wastewater streams.
So there's no danger or concern about the treated wastewater that's being discharged.
This $2 million project is funded by the CARES Act. I'm told testing will officially start on July 27th. The Ohio Department of Health plans to share results online sometime in August. Reporting in Cleveland, TANEISHA CORDELL, News 5.